Welcome back. I hope you had a short but restful break. We can now resume with this live virtual forum for candidates. We now proceed with Professor Yakub, proposed by the United Republic of Tanzania.
Honorable Chairperson, Dr. Luis Mapel Poto, Honorable Ministers, Dr. Chikwe Kuhezu, Regional Director, ADIM Interim, ladies and gentlemen, all protocols observed. A very good afternoon. Bonjour, bon dia, jambo. At the outset, allow me to begin by thanking the WHO Afro-Region Committee for giving me the rare opportunity and privilege to be one of the contestants for the position of the Regional Director. I would like also to pay tribute to a truly distinguished colleague, Dr. Faustin Ndungulile, the former Regional Director-elect. His ultimate passing is what necessitated this electoral process. His memory will continue to inspire us. I sincerely thank every one of you who offered their condolences. Honorable Chairperson, as introduced, I am Professor Mohamed Yakub Janabi. I bring with me 30 years of experience in health and leadership. From humble beginnings as a young GP, I rose through the ranks to become a prominent healthcare executive, public health specialist, a cardiologist, scientist, health diplomat, a researcher, academician, and author. I'm very much aware of the health challenges facing the people of our continent. I've lived them. I'm currently dealing with them every day during my practice. Honorable Chairperson, in my extensive work in public health and leadership, I've always been driven by the vision and ambition to have a healthier, more resilient, and prosperous Africa. I believe I can make important contributions if elected, guided by Sustainable Development Goals, Global Program of Work 14, and Africa Health Strategy. I uphold health as a human right for all, including people with disabilities, while embracing gender equity and equality. I'm committed to ensuring universal access to quality healthcare and strengthening health systems to meet the needs of the present and future generation. Honorable Chairperson, I commend the WHO in collaboration with the government and other stakeholders for its outstanding work in improving health outcomes and well-being, as evidenced by the significant progress made across various health indicators. However, today, Africa stands at a turning point in its history because of the complex challenges that call for an urgent and collective action. These include financial crises we see, geopolitical instability, impacts of climate change, infodemics, the growing issue of antimicrobial resistance, the pressing realities of pandemics, and other public health emergencies. Honorable Chairperson, I've been a senior advisor on health policy and nutrition to the former President Jakaya Kikwete for 10 years, from 2005 to 2015, and currently to President Samia Suluhu Hassan. I've had the opportunity to advise the highest political office in our country on the transformative needs in the health sector. This position has allowed me to spearhead initiatives which have impacted positively in the fight against health crises and establishment of systems that continue to deliver tangible results. So what qualifies me for this service opportunity? I believe that Africa, where it stands today, deserves a leader who not only has the vision, but also the proven ability to deliver results with efficiency and transparency. The challenges we face as a region today demand a bold and practical leadership. Someone who understands the realities on the ground, someone who can work with government and other stakeholders to mobilize resources, and someone who can create tangible partnership to address them. I believe I'm such a leader. During my practice, I've witnessed people missing out on healthcare for lack of finance, and families parting ways with their possessions, the very means of livelihood, just to pay hospital bills. Yet, despite making these heartbreak sacrifices, many still find themselves trapped in debt and poor health conditions. For me, this is a harrowing experience. Out-of-pocket healthcare costs have pushed countless families into the depths of extreme poverty, thereby recycling poverty. This requires urgent solution. I believe universal care is the solution. Honorable Chairperson, I have a long experience in training, research, and working abroad, followed by many years of hands-on fieldwork across the African region. Throughout my careers, I have worked with heads of states, ministers, parliamentarians, community health workers, philanthropies, private sectors, NGO, civil societies, financial institutions, and faith-based organizations. My track record includes transforming healthcare systems from the ground up, even in the extremely challenging and resource-constrained environments. How did we do it? By pioneering innovative healthcare financing, building a stronger health workforce, building infrastructure, initiating outreach services, and successfully managing public health emergencies. So what gives me assurance in my track record? Trust is built on results. My contribution to healthcare is undeniable. I understand the challenges ahead. I bring the new resolve to address them. I'm not only ready for this challenge, but also uniquely equipped to address them and deliver the transformative change our continent urgently needs and expects from us. Having visited many member states, over 30, I recognize the urgent need for a fundamental shift in how WHO Afro responds to specific country needs. I will drive this transformation, ensuring a more agile, country-focused, country-owned, and impactful organization. Chairperson, now I would like to highlight some key personal experiences and achievements. My first point is on strengthening health system. As the founder and first CEO of the Jakaya Kikwete Cardiac Institute in 2014, we were able to reduce overseas referrals by 95%, saving the country more than $10 million per year. The funds saved are now being reinvested in strengthening PHC and financing patients who cannot afford hospital bills. Again, how did we do it? By building in-house human capacity, investing on infrastructure, advocating for an increase of health budgets, engaging private sector, financial institutions, and fostering global collaboration. The Institute has become a regional hub that performs more than 4,000 intervention procedures and open heart surgeries annually, ranging from pacemaker insertion to bypass surgery. Currently, it serves patients from across Africa. Honorable Chairperson, in 2022, I was appointed CEO of Muhimbili National Hospital, one of the largest hospitals in the region with 2,400 beds and 4,000 staff under me. The hospital attendance on average is 3,000 patients per day. Furthermore, I oversee an outreach to a network of 12,200 satellite healthcare facilities across the countries through telemedicine, e-medicine, and artificial intelligence. Our plan is to build a brigade of 137,000 community health workers by 2030. These workers are going to serve as a bridge between the community whom we serve and the formal healthcare system. Honorable Chairperson, this year in January, under my leadership, we secured $363 million from a non-traditional financer, the Republic of South Korea, for health system strengthening, on favorable terms of 0.01% interest, 15-year grace period, and 25-year repayment. This innovative financing will transform Muhimbili and its satellite facilities into a regional hub for preventive, protective, curative, and rehabilitative services, aligning very well with the GPW 14 objectives. If elected, I will endeavor to engage such non-traditional funders from within our region and outside the continent. In the research and advocacy domains, I co-investigated HIV vaccine trials in Tanzania and Mozambique in the early 2000s. Later, in 2012, my advocacy led to the then sitting President Jakaya Kikwete to publicly undergo HIV testing. This reduced stigma inspired 5 million Tanzanians to seek counseling and testing within a year. Likewise, the story repeated itself. In 2021, President Samia Suluhu Hassan openly championed and publicly received the COVID-19 vaccine, significantly increasing its uptake across the country and reducing infodemics. My second point is emergency preparedness. In 2015, the UN Secretary General Ban Ki-moon appointed President Kikwete to lead a UN high-level panel on global health crisis after the Ebola outbreak in West Africa. As a senior advisor, I visited the affected countries of Liberia, Guinea, and Sierra Leone, gaining invaluable hands-on experience, and the panel's recommendation contributed to the efforts to transform the WHO approach to managing emergency crises that we observe today. My third point is on demographic response. The African continent is experiencing a demographic transition with its youthful population, offering both opportunities and challenges. Now, when you have a young population, it can drive growth and innovation. It's also highly exposed to risk factors such as substance abuse, unprotected sex, teenager pregnancy, mental health disorders, to mention a few. On the other side, as the population ages, it is crucial to prepare our healthcare systems to address the needs of older generation. My fourth point is on fresh perspective. I am ready to champion fresh ideas and innovative approaches that can revitalize our organization and drive impactful reforms. My work in Tanzania, advancing PHC, along with my experience abroad, has given me a first-hand insight into the barriers to healthcare access and their profound impact on our communities. Honorable Chairperson, the challenges ahead are so broad and multifaceted. A member state or any organization cannot manage on their own. To address them effectively, we must act together in bilateral and multilateral relationship. I'm committed to addressing the challenges by focusing on my 7 key priorities presented in no particular order. My first priority is universal health coverage and the SDGs. With less than 5 years remaining to achieve the SDGs, many indicators show we are off track on achieving them. In our region, for example, the universal health service today is 46, while the global index, 68. Globally, today, 4.5 billion people lack full access to essential health services, half of the world, with 1 billion experiencing catastrophic out-of-pocket expenses, pushing families into poverty. I'm committed to the achievement of universal health coverage. My second priority is sustainable financing. Our current financing model faces persistent challenges, worsened now by the acute shift of global financing policies. Currently, 80% of the WHO budget relies on voluntary contribution, many of which limit our autonomy of earmarking because of earmarking. Member states' assessed contribution is only 20%, and sometimes even less. So sincerely, I support efforts to increase the assessed contribution, which is going on. As for supporting member states, mitigating the catastrophic decline in external funding, I will work with governments to secure diversified funding through health insurance schemes, public-private partnership, blended financing, debt for health swaps, and global debt cancellation. This will help bridge resource gaps and offers our region a valuable opportunity to establish a resilient, self-sustained health financing system. My third priority is strengthening emergency preparedness. We must strengthen our health system through strong health workforce, disease surveillance, intelligence system, enhanced rapid response mechanism, cross-border cooperation, and sharing the best practices. My priority will include championing of implementation of the amended IHR and supporting the development and implementation of the pandemic accord. My fourth priority is maternal child health and nutrition. Africa bears 70% of the maternal deaths, 56% of under 5 deaths worldwide. Additionally, the high prevalence of stunting compounds these challenges with profound implications for the continent. However, amidst these grim statistics, there is a beacon of hope. In Tanzania, maternal mortality dropped by an impressive 80% between 2015 and 2022, a testament to the transformative power of primary health care and strong political commitment. In recognition of her able leadership in this, President Samia Suluhu Hassan was awarded the prestigious Goalkeeper Award in 2024. My fifth priority is combating communicable, non-communicable, and neglected tropical disease. Through robust disease control strategies, promotion of healthier lifestyle, and a One Health approach that recognizes interconnectedness of human, animal, plant, and the ecosystem, I will work with the governments and partners to address the high burden of these diseases by implementing a comprehensive cross-sector strategies for prevention and control. My sixth priority is tackling antimicrobial resistance. Now, this is a crisis unfolding in a slow motion. Currently, it's responsible for 1.2 million deaths annually. This is compounded by the lack of surveillance data in 40% of our member states, leaving gaps in understanding the extent of the problem. I will support the establishment of the regional databases and efforts to combat the crisis. My seventh priority is building local manufacturing capacity. What did COVID teach us? COVID revealed critical gaps in our local capacity to manufacture diagnostics, therapeutics, and vaccines. Over 90% of these public health products are imported, and this heavy reliance poses a significant threat to our region, to both supply chain stability and health security. Hence, boosting local production is the key to economic growth. I believe it's high time to involve our non-traditional partners, including the diaspora healthcare world, who can contribute significantly through expertise, training, and mentorship, thereby strengthening health systems and promoting sustainable development. I'm a living example. I'm a Tanzanian diaspora. I will leverage health diplomacy to catalyze health system strengthening, partnership, and elevating Africa leadership in global health governance. Honorable Chairperson, allow me to conclude by extending my heartfelt congratulations to Dr. Moet and our team for the inspiring leadership and outstanding contribution, to all WHO Afro member states, WHO staff at all levels, and collaborating partners. If elected, I look forward to working with you. I extend my profound gratitude to President Samia Suluhu Hassan for placing her trust in me. I humbly ask you for your vote on the 18th of May 2025. Together, we can shape a brighter future for Africa. Together, we can have the power to transform our mother Africa. Thank you, Merci beaucoup. Muito obrigado. Asanteni sana.
Thank you, Professor Yakub. We'll now continue the interview with questions and answers. I will now pull the first token with the name of the regional committee member which expressed their wish to ask a question to Professor Yakub. Côte d'Ivoire.
Savoir expérience dans la gestion des urgences au niveau
to find out more about the management of emergencies. What would your strategy be to respond to the various emergencies? Speaker's sound is intermittent. We apologize. Perhaps the honorable delegate from Côte d'Ivoire could adjust his sound.
So can we come back to Côte d'Ivoire after we ask another member state to ask a question?
Je suis audible maintenant.
I will now give the floor to Ghana to ask the question. Ghana.
Hello.
Ghana. Ghana, you.
Yes, I just want to thank you for the opportunity to ask this question from the Ghana team to our candidate. Want to thank you for the lucid presentation. But straight to the point, I just want to ask Prof, in a brief sentence, what legacy would you like to leave as WHO Africa leader who is trying to lead the region? And also, how would you measure the impact of your leadership on the health and the well-being of the people of Africa as our leader for the region? And how would you measure the impact of your leadership on the well-being of our people in the African continent? Thank you very much.
Honorable Chairperson, thank you for the question. A very good question from Ghana. My answer with this, what legacy do I want to bring? The first thing, I'm trying to look what is happening to the world today, what is happening to our region today. One of the things which I'm going to leave after my 5 years or 10 years, depending, is to leave our continent dependent, self-sufficient, by domestic financing, innovative way. I want to see, as I said, 4.5 billion people are pushed into poverty. Majority of these people live in our continent. It concerns me. Do we have a way to get out of this? Yes. By being independent, by increasing our workforce. We have to invest on community health workers. Because if we are talking of primary health care, which is a backbone of universal health coverage, we have to prevent the disease. And the only way we can do it is by strengthening Africa workforce for transformation. I would employ innovative strategies to build a resilient health workforce, particularly the community level, empower the community health workers, enhance retention and motivation. Why our people are leaving? Motivation, one of them, infrastructure has to be better, has to be equipped. By task shifting, we have to invest on education and research, expanding, because we are talking of evidence-based medicine. We have to foster on our regional collaboration. I'm going to invest on mapping. What is Ghana having, which Tanzania doesn't have? What is ECOWAS having, which East African Community doesn't have it? Or the regional economic communities. We have to work with Africa CDC, the African Union, and strengthen our policies, which will help countries to develop national workforce strategies, advocate on increased government support and resources for health. Look at Abuja Declaration, more than 2 decades now. So what can we do? And in order to fill the gap, one of the approaches which I suggested in my manifesto, we have to have a discussion on debt relief. Because now, our region, we are using a lot of money servicing the debts. Can we do debt swaps? Debt for health? So these are very crucial. But if you look on what is happening now, I think one among is planning. What actions can be taken immediately?
Thank you for answering the question. Can we go back to Ivory Coast? Ivory Coast, are you ready?
La Côte d'Ivoire est prête. Est-ce que vous m'entendez correctement?
Côte d'Ivoire is ready. Can you hear me clearly? Asks the speaker. Thank you.
Yes, we are hearing you.
I would like to ask a question to the colleague from Tanzania. What is your experience in handling health emergencies? And what would your strategy be to responding to the numerous emerging emergencies like Mpox, EVD, cholera, that are linked to political and health crises? So I'm talking about emergencies in our various countries. Thank you very much.
Honorable Chairperson, Honorable Minister from Côte d'Ivoire, addressing health securities, threats such as pandemics, which you have just imagined, emerging diseases, antimicrobial, it requires a robust leadership, a coordinated one with a One Health approach, and very well-resourced systems to effectively detection and response. Now, I'm a living example. 2023, Tanzania had Marburg. This year, the one which I'm talking, we have Mpox, which we have just declared. So what have we done? First is strengthening our health security system. So we're collaborating with member states to build capacities in disease surveillance, laboratory and diagnostics, rapid response, and this is exactly what we did. We had regular simulation, and after action reviews, we had a lot of stockpiles in the regional, so we didn't have to run. I'm living in Dar es Salaam, for example. The place where Marburg occurred is 1,400 kilometers. So enhancing the regional stockpiles, logistic enhancement, it helped very much in managing Marburg and Mpox outbreaks in 2023 and 2025. The regional collaboration is very important because in October, there was an outbreak in Rwanda. So we have to approach it in a multi-sectorial way, in a One Health approach. Building our own capacities, this is very important. Health workers development, scalable emergency response system. I spoke about fostering the regional and international collaboration, monitoring, ensuring accountability, and establishing metrics for preparedness. So engaging the community and the risk communication, it's very crucial in facing the pandemics. Because of time, I haven't spoken about antimicrobial resistance, which is another in our region for any epidemic which will come. So it's all about preparedness, about the surveillance. I spoke in my manifesto. We have in rapid response.
Asha 9 gave the floor to Guinea to ask the question. Guinea, are you there? Guinea, can you kindly unmute yourself? Guinea? Please check and see if you are muted. I will select another member state and come back to Guinea later. I will now give the floor to Zimbabwe to ask the question.
Thank you, Chair. Thank you, Dr. Janabi, for the presentation. The looming challenge of antiretroviral therapy following the United States government promulgation is a reality. What measures can be put in place to ensure equitable access to ARVs for the marginalized population, especially the low resistance in low resource settings? Secondly, how all changes in policy affect the affordability of ARVs and patients, and what can be done to mitigate from the financial barriers created? Thank you.
Madam Chairperson, I missed the first part of the question. Is it on financing on the ARVs? Can the question be repeated, please?
Okay. Sorry. What measures can be put in place to ensure equitable access to ARVs for the marginalized population, especially in the low resource settings? Thank you.
Thank you, Madam Chairperson. Thank you, Minister or Delegate from Zimbabwe, for the question, what can we do to put in place for the marginalized people who are very important, and is in my manifesto too. So I think the first thing I'll go to is address the primary health care. Because where do these people live is in the community. So addressing primary health care and universal health coverage requires a comprehensive approach. I do have first-hand experience working with two presidents, 13, 14 years now. Just to cite a few examples, the past few years, we have built about, around more than 8,000 centers. So what do these centers do? One, it will strengthen the foundation of PHCs, invest in community health workers, equip the primary health care facilities, promote telemedicine where it's far to reach these digital people. But crucial, which we are in crisis now, advocate for increased domestic financing. Budget allocation, encourage the government to allocate the Abuja Declaration, which was 15%. improve accessibility and equity, establish more primary healthcare facilities and mobile clinics in remote areas to support the national insurance schemes for the vulnerable. We have to strengthen the health system for resilience. You need workforce development, data-driven decision-making. We have to accelerate towards universal health coverage. Our policies, our legal frameworks to support an embedded universal health coverage principles in the health process. We have to foster a multi-collaboration. But for example, Madam Chair, if allowed, what we have done quickly after this crisis to try to look these vertical programs. I don't say all vertical programs are bad, but can they be integrated to our normal services? Because it will bring these patients to our normal systems, which are funded by most of the government. So adaptation, I will really discuss on the flexibility when crises or challenges happen, whether it's a pandemic or a climate change. So we have to have a very resilient system which can cope not only with the climate change, but like the financial crisis which has just happened. How can we cope fast? How can we adapt with the situation?
We will now ask Guinea if you are available. Can you come back and give your question? Kindly unmute yourself, Guinea Conakry. If Guinea is not available, I will.
Hello? Hello?
Yes, hello?
Hello?
We can hear you.
Oui, allô? Oui, bonjour à tous. Félicitations.
Greetings to everyone, and I'd like to congratulate all the candidates who've made their presentation. I'm the Minister of Health from Guinea. I hope you can hear me. Can you hear me? Kindly confirm.
Yes, we are hearing you.
D'accord, vous m'entendez?
Thank you. I have a question for the candidate regarding financing of the health sector. From 2001 in Abuja, governments were supposed to allocate 15% of their national budget to health. Unfortunately, not all countries have honored the 15% pledge. What strategy would you as a candidate put in place to ensure that countries commit to the 15% allocation to the health sector? It's just the first question. My second question is the coordination of...
Only one question.
Guinea Conakry, you are permits me to kindly ask you, you are entitled to only one question. I'm sorry, just one question.
Okay. Thank you.
Thank you, Honorable Chairperson. Thank you, Minister from Guinea-Conakry, for a very valid and important question to our region. It's true, Abuja Declaration requested our countries, respective countries, to finance at least 15% from our budget. So it's if elected, our member states are 47. Not all of them are equally in economic sense. So I think the first thing which I would like to do is a country specific. Honorable Minister, I will listen to you. I will talk to you. So I will go for each country specific. For example, there are countries I'm going to engage them in strategic resource mobilization. Work to diversify our funding sources by engaging both our traditional and non-traditional, including international donors, the private sector, the philanthropic organization, So I would advocate for increasing the domestic budget. I've discussed a little bit about what happens with our debt. Can we discuss about cancellation or swap of the debt? Because how much our countries are spending on servicing the debt. Can I take that fund and put it in the 15%, which is greater? I will foster the public-private partnership to bring an additional source for our health, which automatically will secure our health security. I will enhance coordination and international partners. We have to strengthen our partnership with multi-organizations like Gavi, the Global Fund, and other UN agencies. The African Union is there. Support on innovative in resource utilization. We have to encourage adoption of innovative, cost-effective solutions to maximize the use of the little available resources we have. We have to strengthen our monitoring and accountability. One of the things which our partners sometimes worry is our accountability. Can we be more transparent? Can we do more audit to our accounts? Can we put our accounts open so that we can build the faith or the trust which our donors sometimes do? But whichever way we want to look, the innovative domestic funding, we just got a wake-up call with the current crisis which is happening. I think we have to look at it in a more wider. We have recently 40% of the minerals are from our continent. How much are we using it? Added value, levies, can we direct this fund to the health? So I think, Honorable Minister, I'll come to you with great humility. I will listen to you. I will listen to your advice. But together, I think there is a way for our region to be more financially self-sufficient. Thank you, Madam Chair.
Time for this interview has been exhausted. Thank you very much, Professor Yako, for being with us today. We'll now proceed with the interview of Professor Mustapha Majiyawa, proposed by Togo. Professor Mustapha, you have the floor. We aren't hearing you.
Merci, Madame la Présidente.
Thank you, Madam Chair.
J'espère que vous m'entendez.
I hope you can hear me.
Yes, you are clear.
Merci, Madame la Présidente.
Thank you, Madam
Je voudrais avant
Chair. At the outset,
présenter encore une fois mes condoléances
I would like to convey once again my condolences on the passing of our brother, Faustin Dugulile, and to pray for the repose of his soul.
sa vision et son engagement.
His vision and commitment for health in Africa were extraordinary.
Je voudrais rendre hommage au Dr.
And
pour le travail.
I would like to pay tribute to Dr. Moiti for the work she did, and to pay tribute to my brother Chikwe for the acting role, and pay tribute to Dr. Tedros for the work that he's been doing for many years at the head of the World Health Organization.
Je vous dis, Mesdames et Messieurs les ministres, Madame la Présidente,
Honorable ministers, Madam Chair, delegates from member states of the African region of WHO, thank you for the opportunity that you're giving me to discuss with you on what I hope to do at the head of WHO in the African region if you bestow your trust on me. And the happy and extraordinary thing is that circumstances have led me to understand our organization and many of you over the past few years, during which I had the privilege to be Minister of Health in Togo. And in that capacity and within that period, I had the time to conduct 11 key actions, flagship actions at the head of the ministry. That's to transform the mode of management of our health facilities based on the contractual approach, which is one of the recommendations of the WHA 73. That reform was motivated by the situation that we've discovered and, what was happening in the hospitals and the performance of the hospitals. So the reform had to do with leasing out these facilities to a private company to manage it in an inclusive manner. And while the state, of course, maintained its sovereign prerogatives. And the reform led to a net improvement of the 8 hospitals that were leased out for management, and an improvement in the number of consultations, an improvement in lab analysis, improvement in X-ray, availability of medicines, reduction of bad practices. And these reforms led to adjustments as we went along. The results of this contracting out, or this outsourcing, was established by an assessment that was made by WHO at our request. And we were able to present these results at the WHO Regional Committee for Africa in 2022. And they were also recorded in a book published by Hamatan Publishers. And in a bid to share our Togolese experience, I would like us to share that experience. And second key action was the effective management of 2 major epidemics, meningitis, 2016, and another one in 2023. The third key action was tackling neglected tropical diseases, and Togo being the first country to eliminate 4 of these diseases, dracunculosis, trachoma, and human African trypanosomiasis. And a prize was awarded to the head of state of Togo by the Director General of WHO at the regional committee session in 2022. Furthermore, Togo is on track to eliminate 4 other diseases: onchocerciasis, schistosomiasis, leprosy, and yaws. Fourth major action is the effective and integrated management of populations that are facing terrorism in the north of the country, using the One Health approach and using concerted actions, bringing together several ministries. Fifth key action is the organization by Togo of the regional committee meeting in 2022. Sixth key action, close collaboration for purposes of efficiency between the Ministry of Health and training centers, medical training centers, and between the Ministry of Health and technical and financial partners. Seventh key action, efficient use of human resources through the assignment of qualified workers to regional hospitals. Eighth key action, the opening of paramedical schools in each of the economic regions of Togo, preparing the workers mentally to work in rural areas and in remote areas. Ninth key action, mobilization and management of financial resources that has led to increased confidence of partners and attracted investments. 10th key action, universal health insurance, implemented as from 2011, before it was progressively extended to the informal sector, and then its generalization to the entire Togolese population since January 2024. 11th key action, the Lume initiative in January 2020, that is the fight against substandard and falsified medicines. You know, the role of minister that I held for 9 years was preceded by care activities in research in the university where I was since 79. Care activities within the University Teaching Hospital Sylvanus Olympus in Lomé, which is the biggest hospital in Togo. And then a consultant that I was for about 25 years, and within the hospital setting within that period. Then I also carried out teaching activities, you know, as a rheumatologist, and then participation in 8 panels for aggregation, you know, for the title of professor, and management for over some 30 years in a big medical center in Togo. Our research activities led to the publication of 150 research works and also other works on health facilities in Togo. On the continental level, I have taken part in all sessions of the Regional Committee for 9 years, the World Health Assembly for 9 years also, and I chaired the first interministerial conference of Africa CDC and the selection panel for the director of Africa CDC, that is Jean Kaseya, whom I greet. Madam Chair, honorable ministers and delegates, it is on the basis of these assets that I would like to request your trust and your support to head the WHO African region for the next 5 years. My ambition is to make our continent a space where access to health is made possible for all by means of an efficient and resilient system through a program aligned with the Sustainable Development Goals and the 14th General Program of Work of WHO. We will strengthen our achievements and innovate by connecting WHO support to the specific reality of each country. And for that purpose, my priorities are the following. The first priority is an efficient and resilient health system by supporting member states for the following measures. Investing more in health by increasing the domestic budget allotted to health, but through innovative mechanisms also, and making them effective. I intend to impose taxes on cosmetic products, in addition, of course, to the taxes on alcohol, sugary drinks, and the rest. Using public-private partnership to mobilize and manage resources. You know, the whole state structure has shown its limits. I mean, rigorous management and the principle of accountability and responsibility, as the current situation actually makes it imperative and necessary, without forgetting that the best way to mobilize resources is proper use of the systems that we have. Training, attraction, retention, and effective use of human resources. Evaluation together with universities and higher education institutions. The real impact of university systems on the health system. Intersectoral collaboration with the Sustainable Development Goals, notably connected to health, poverty, food, safe drinking water, and education as part of the One Health approach. Use of artificial intelligence, especially in terms of optimal use of specialists through telemedicine, contextualization through combining the support of partners to national plans, with WHO serving as a lead. Second priority of my strategy, universal health coverage, motivated by the need of equity and for social cohesion, and the key role of health in development, which has been proven beyond doubt today. This coverage shall be undertaken through strengthening political commitment, through national strategies, and the implementation of a monitoring and evaluation mechanism. Third priority, tackling epidemics and disasters and promoting health security, notably by strengthening country preparedness through adequate structures and tools, promoting a fund for disasters that can be easily mobilized, and taking into account antimicrobial resistance. Fourth priority, effective measures to reduce the impact of diseases, communicable and non-communicable diseases, as well as accidents resulting from road traffic injuries that are very common in our African region, through policies of prevention, strengthening of personnel and technical capacity of hospitals, promoting mother and child care, care for older persons, hygiene and sanitation of the environment, participation of the community, development and implementation of plans for community health workers related to the policy of decentralization, and fifth priority, local production and rational management of drugs, vaccines, and inputs through, notably, regional centers, promotion of a policy of pooled procurement of health, of medicines, promotion of traditional medicine and traditional medicine research, fighting against substandard and falsified medicines, notably related to the LUME initiative, the African Medicines Agency, and international conventions in this area. Regional implementation and sub-regional implementation of measures to regulate the medicines market. Sixth priority, tackling the determinants of health, notably those related to climate change, which serves as disease vectors to communicable and non-communicable diseases through heat waves, hurricanes, flooding, deforestation, drought, pollution of the air, water, and the soil. And this struggle should be conducted through the One Health strategy. And lastly, seventh strategy, WHO governance and administration. We need to consolidate and build on the achievements, notably those achieved under my sister, Dr. Matshidiso Moiti, to whom I pay tribute, making the Secretariat more efficient, and bringing to the fore collaboration with member states, taking into account the realities, the needs, and the specific conditions of each country, and making more fluid while respecting the procedures of the organization, strengthening collaboration with Africa CDC, which with WHO in the African region are two sides of the same coin. Strengthen equitable access to the various decision-making posts, implement the transformation objectives of WHO by continuing the action started by Dr. Moiti and encouraging states to engage more. Madam Chair, honorable ministers and delegates, this summarily presented is what I hope to do at the head of our institution if you bestow your trust in me. The actions will be based solely on the needs of our population and the states that you ministers of health represent. As you see, these priorities are interconnected, and they are articulated around the health system, that is service delivery, health workers, health products, vaccines, and health technologies, health information, financing, and governance. My profile suits the implementation of these aspects because I'm an academic. I've held posts of responsibility at national level in the health sector, and I've also managed continental institutions in charge of health. Innovation would guide the actions that I will lead with you, and full involvement of communities in the implementation of primary health care, in the healthy management, sane management of resources, strengthening of public-private partnership, and raising professional consciousness of health workers, and effectiveness of universal health coverage on our continent. Together, we will make our continent a space where priority to health is not just a slogan, but a reality. I thank you for your kind attention.
Ladies and gentlemen, with your permission, I would like to say a few words in English.
You are muted. Can you kindly unmute yourself, Professor?
My name is Mustafa Mijiawa. I'm from Togo. I worked as professor of rheumatology for 25 years before serving as Minister of Health for 9 years in my country. I thus had the opportunity to manage epidemics in my country's entire health system. My 9-year experience has given me the opportunity to become familiar with continental and international institutions involved in health. And my background as professor of rheumatology and minister of health has equipped me with the skills I need to collectively manage WHO Africa with you. You can trust me, and I know I can count on you. Thanks. Obrigado.
Thank you, Professor Mustafa. We'll now continue the interview with questions and answers. I will now pull the first token with the name of the regional committee member which expressed their wish to ask a question to Professor Mustafa. Central African Republic. Central African Republic, you have the floor. Can you kindly unmute yourself? The representative from Central African Republic.
Merci beaucoup, cher professeur.
Thank you very much, dear professor.
Quelle initiative mettriez-vous en place?
What initiative would you implement to reduce health inequalities between rural and urban areas and amongst different socioeconomic groups? how do you intend to bring greater equity in the representation of member states within our organization? I thank you.
Merci aux délégués.
I'd like to thank the delegate of the Central African Republic. The first question, because you asked two questions actually. The first relates to the principle of reducing inequality between rural and urban areas. And that question is all the more relevant and interesting as it falls in line with one of the priorities I explained, that is universal health coverage. We know that rural areas are often left behind, and universal health coverage is one of those mechanisms by which we can reduce such inequality. So to implement universal health coverage, we need, of course, to increase the health budget and then to carry out advocacy with states for universal health coverage. And that requires also working with the most disadvantaged population groups, which are in the majority. That is what we've been doing in Togo since January 2024, making health insurance mandatory to be sure that it covers the entire population, encourage health organizations within the communities, because it will help our rural communities clearly. And then also encourage the private sector. And in that case, there is a second aspect. When you look at private insurance today, it focuses mostly on curative services. But we can convince our friends of the private sector to invest more in preventive services, and which will lead to a reduction of services, And of course, as part of universal health insurance, we need to think of the most vulnerable groups, that is, who live amongst rural communities. So that is what I can say in summary, in terms of reducing inequalities, and adding also that, of course, there are other factors that do not depend on the health sector. And of course, the Sustainable Development Goals, especially those related to poverty, sanitation, hygiene, and provision of drinking water. So that is the answer I can propose to your first question. Now, Madam President, can I move on to the second question?
No, please. Just one question he was entitled to. I will now select Saitomi and Principal to ask the question, and I'll give them the floor. Saitomi, are you there? Seychelles.
Merci, Madame la Présidente.
Thank you, Madam Chair.
Ma question est la suivante.
Here's my question.
Professeur, pensez-vous qu'il y a
Professor,
un peu trop de
don't you think
du travail dans la région
that is
africaine
a bit of duplication in the work of WHO in the African region? And maybe it is for that reason that we do not see a lot of results in terms of health on the continent.
Merci au délégué.
I thank the delegate from Seychelles. Well, I suppose that what you mean by duplication of work in the African region is the absolute need for coordination at all levels. First, within countries, and with the various partners. As Minister of Health, I observed that the same topics, the main targets were called upon to intervene, and their interventions were not coordinated, the various partners. And I think that is part of the advocacy that we should conduct with our friends ministers of health, to request that all the partners, when they intervene, it should be on the basis of consultation. They should work together. For instance, we cannot imagine regular meetings or hold regular meetings to know what the other partner is doing. In relation to the National Health Development Plan that has been adopted, that will avoid duplication, and that will enable us to be more efficient. Now, at the continental level, a while ago, I said that the African region and Africa CDC, whose first board of administration I headed, should work together in a concerted and coordinated manner and make us more efficient. It should also be noted that the two principals, that is Dr. Moiti and Dr. Kasela, we realize that there is greater coordination so that these two continental bodies are not dueling together, but working as partners. They work in synergy. So that is the answer I can provide to your question. Thank you, Professor.
I shall now give the floor to the Gambia to ask the question. Gambia, are you there? The Gambia, can you kindly ask your question? If you are muted, please unmute yourself.
Okay, thank you very much, Madam Chair, and your brother out there. As a continent, we have this current issue of procurement of relevant drugs, more so in our part of Africa. Sometimes this has to do with the volume, for individual countries. Do you have any plans in place, to see how this could be eased, for most of us?
Merci à mon frère.
Thank you very much, brother from Gambia. The question you ask is both crucial and pertinent, and we've experienced it. We experienced it during COVID-19. And that is where the opportunity arose for grouped procurement, grouped ordering of medicines. Of course, each of our countries is of a different size, has a different sized population, and individually we don't carry much weight, which is why we need grouped procurement that makes things more fluid and makes medicines less expensive. We saw this in the initiatives that were undertaken by our heads of state. We saw this under COVID-19, and that is the road to follow. This is also true when we think about setting up local production units. In other words, we need to have regional hubs. We can't imagine that every individual country will be manufacturing goods for itself will need regional hubs, and that means we'll need to place grouped orders, opt for group procurement. That will improve matters and will improve the volume of our orders and reduce costs. So I think that is an outline of what we will do in terms of buying medical products and medicines. We can also note that collaboration with Africa's CDC was of the essence during COVID-19. And so we will draw lessons from that experience and look ahead, seeking to strengthen our group procurement efforts, which doesn't in any way undermine the principle of sovereignty of each of our individual countries. Thank you.
I shall now give the floor to Zimbabwe to ask the question.
Thank you, Chair. Thank you, Professor Mustafa. With the withdrawal of 18% from financial support to WHO, how do you envision the role of WHO in Africa evolving over the next 5 years? Thank you.
Professor Mustafa?
Oui, merci à mon frère.
Thank you very much to my brother from Zimbabwe. It's true that financing is very important. It's one of the pillars of our health system, and it's also true that we're crossing a particularly different period in time with certain important partners withdrawing. The first thing we'll need to do is focus on advocacy in our countries to increase, to bolster health financing. And when I say funding health or financing health, that isn't simply looking at the monies allocated to the health ministry. I'm thinking about all health determinants that have an impact on health. Of course, in many of our countries, water stewardship is different. It doesn't sit in our health ministries, and we know that a significant parcel of our population doesn't have access to drinking water. So when we look at financing for drinking water, this has to be encouraged by the health ministry as well. And so there is the money allocated by the state. There's also innovative financing to consider. I propose that we add cosmetic products to the list that we are already familiar with, products that are taxed. And we also need sound management, strict management. The fewer resources we have, the more rigorous, the stricter we need to be. And I was talking earlier about our partners. There is need for coordinated action on the part of ministries so that we have greater energies, greater efficacy in all our actions. And often when we talk about financing and resources, we think about inflows. But sound management is fundamental if we're to increase the resources available. And it also allows us to be more efficient. The current situation is going to encourage us even more to look inwards and to count on ourselves, first and foremost. And this is the kind of advocacy I hope to lead if I have that role, working with the different authorities in the different countries. We also need, as I've said, and I repeat, good management to motivate the different partners. Thank you very much.
I shall now give the floor to Ghana to ask the question. Ghana, are you there? Kindly unmute yourself. Ghana, are you there? Are you ready? If not, I will ask another member state. Uganda. I will now give the floor to Uganda to ask the question.
Did you say Uganda? Chair, I hope you can hear me. Thank you, Professor Mustafa. My question.
No, Uganda, we are not getting you. Can you restate your question? No. Uganda, there are some challenges. Can we call you later?
Offices for enhanced support to the countries.
Did we say Ghana or Uganda?
Uganda, can you repeat your question? Uganda.
Okay, Uganda. Thank you, Professor Mustafa. Given the dwindling resources, the question is, how do you propose to strengthen WHO country offices to enhance their support to the countries?
Merci.
Thank you. My brother from Uganda. How to strengthen country offices? That's a very interesting question. And it underpins one of the transformation concerns of WHO. The first thing will be to take into account the specific needs of each country. And very often, WHO support is technical in nature. We saw this in Togo when we had to deal with epidemics. We were able to collaborate with the country office of WHO, and based on the needs identified, WHO the national team. Similarly, also through WHO, we benefited from advice and tools, namely equipment adjusted to the needs in the country. So, in other words, it's WHO that's mobilizing staff and expert knowledge, and that allows us to support where support is needed. That, of course, requires the coordination I spoke of earlier and the contribution and support of the different partners. Our country offices should be set up in such a way that they are country-specific, adapted to the country. We can't have one-size-fits-all model. But this means that the Ministry of Health of the country will need to coordinate closely with the national representative of the WHO in order to identify needs as required, and so that the WHO can then propose how it can contribute, how it can support the country. At the same time, other partners who may also have contributions to make to resolve a given problem, those partners need to also liaise with the national WHO teams so that there's coordinated, concerted and efficient action. Thank you.
The total time for the interview has been exhausted. Thank you very much, Professor Mustafa, for being with us today. And this concludes the live forum for candidates for the WHO Regional Director for Africa. I would like to thank all member states of the WHO region and the candidates for having joined this forum today. We had a rich exchange, which will be valuable to member states in their assessment. I also personally want to extend my thanks and appreciation to the RD, Dr. Chikwe, for the hospitality that's been provided in the environment for us to have this forum. I'd like to thank the Secretariat for organizing it, and I can assure you that the member states in May will make the best election. I wish you all a good day and look forward to seeing you in person in Geneva on the 18th of May, 2025 for the second special section of WHO Regional Committee for Africa. There's a saying that you leave the best for the last. So permit me to introduce myself. I'm Dr. Louis Maple-Poto, and I'm the Minister of Health of Liberia. I served as the second vice chair for RC 74, and currently I chair this section for and on behalf of the member states. Thank you for having me as your chair.
Thank you.
Yeah.
Merci.
So I hereby, with the power vested in me by the regional director, declare this section closed.
Thank you very much.
Merci beaucoup. Merci, thank you. Obrigado.
Good luck, everyone. Good luck. See you.
See you.
Try again. Let him try again. Let him try again now because it was hidden underneath. Vous pouvez laisser le Guinée, mon pays.
Oui, merci. Donc, voilà, j'essaie de parler depuis la salle d'interview de la Guinée. Et je suis donc, nous pensons que la salle elle est prête. Nous sommes assurés que la connexion Internet soit stable. Nous nous sommes assurés que la vidéo, l'éclairage, la qualité de la vidéo soit bonne. Nous nous sommes assurés que l'électricité soit stable. Et nous nous sommes assurés que dans cette salle, qu'il y ait moins de bruit, que ça ne soit affecté par les bruits d'autres bureaux.
Okay, thanks. Elizabeth, how are you getting that?
It's even worse.
It's even worse.
It's not good. It's not good.
Okay.
The old sound is not clear.
It's breaking and then it becomes like metallic. robotic and then back again. So it's not stable.
Aussi, excusez-moi, je voulais vous dire que j'ai mis 2 micros. Peut-être que je peux enlever un et maintenir un seul.
Oui, essayez ça pour voir, parce que pour l'interprétation, le son n'est pas suffisant.
Et Hierro, les deux sont synchronisés, c'est pas ça. C'est pas une histoire de un micro ou deux. C'est pas une histoire de un micro ou deux.
Oui, laisse-nous tester quand même, on essaie jamais.
On peut au moins essayer. On peut essayer, ça ne coûte rien.
Laisse-nous essayer, ça ne coûte rien.
Oui. Et Hierro, what I would like to propose, ce que j'aimerais proposer, que quand on fait le test, que vous regardez dans la caméra, donc devant, parce que là, vous faites le test dans une direction dans laquelle, voilà. Et le micro devrait être maintenant, et le laptop, et je ne sais pas quoi. Il faudrait voir comment vous faites pour que le laptop ne soit pas gênant dans l'image. Mais s'il n'y a pas une caméra à part que vous pouvez fixer sur la table, vous m'excusez.
La caméra est good, hein?
Plus proche, d'accord. On peut l'approcher, la caméra.
Non.
Maintenant, au moins, vous regardez.
Ok, maintenant.
Regardez face au public, c'est déjà mieux.
On peut enlever.
C'est juste, moi je pense que la caméra c'est ok, c'est juste le son.
Can we do for Côte d'Ivoire?
Ok, laisse-moi, je vais réduire. Ok, maintenant, j'ai un seul microphone. Je ne sais pas si la qualité est bonne.
Yes,
toujours la même.
But we're hearing, but she's saying it's breaking.
C'est toujours la même chose.
Whether the problem is on the side,
Okay.
rather.
So the problem, because even when she's talking, it's breaking.
Je peux essayer de mettre la caméra, le microphone de l'ordinateur pour voir.
You can hear them.
It's not that bad as Elizabeth.
Yeah, I think Elizabeth, you have a problem because it's not breaking.
L'autre, c'était mieux avec la
It's not stable. You know, it starts well, then it deteriorates, and then it comes
I think
back.
it's
Hello?
Elizabeth. I think we hear him. But they're not breaking. I think we hear you breaking. It's from your end.
Ask somebody else online. How do the others hear online?
Wait. Dan, can you go to Elizabeth Kwavi's office et vérifier l'internet? Il faut être connecté sur les câbles. Oui.
Rosalia, est-ce que tu peux nous confirmer comment est le son de ton côté? Comment tu nous entends? Comment est-ce que tu entends le collègue de la Guinée?
Je vous entends très bien. Le collègue de la Guinée, je l'entends un tout petit peu moins bien.
D'accord.
Ouais, ben.
Et est-ce que c'est au point où il y a des coupures dans le son ou le son qui devient métallique?
Non, il n'y a pas de coupure, mais c'est un petit peu moins clair. Je ne sais pas si métallique, ce serait le mot, mais c'est un tout petit peu moins clair.
D'accord.
Okay, can we do the test for Côte d'Ivoire whilst we check with the...
Bonjour Côte d'Ivoire, est-ce qu'on peut vous avoir pour le test, s'il vous plaît?
Oui, bonjour à tous, je suis Ngeti Adou. Je suis l'IT du bureau d'Abidjan. Donc, comme mon collègue l'a dit, nous avons fait les installations et nous attendons vos appréciations avant que il y a des choses à corriger, on va le corriger. Merci.
Voilà, et l'autre, il est avec un laptop, c'est pas...
Si.
Pardon.
Est-ce qu'on peut vous avoir... Oui, s'il vous plaît, continuez.
Ok, d'accord. Bon, je ne sais plus ce que je vais vous dire. Je ne suis pas le candidat, mais une chose est sûre, le candidat nous a contacté qu'il allait passer aujourd'hui pour vérifier avec nous les textes. Donc, on l'attend. Et nous, de notre côté, bon, nous avons fait pour l'instant le maximum, c'est assurer de la connexion. On a même mis un backup pour la connexion aussi. Bon, la salle, on l'a essayé de préparer.
Okay,
Merci.
Gaita, can you stop?
Yeah.
Can you put Rosalia?
Mark, I didn't hear you.
Yeah, can you?
Yeah, I can speak. Can you hear me?
Yeah, I can hear you.
Devant lui avec une caméra, c'est pas un laptop.
Rosalia, continue.
Non, non, mais l'autre avait aussi le même système et le laptop.
I can
Say
hear very
something.
well Noemi and Nico speaking. I can hear a bit less well Côte d'Ivoire. So should I just continue and say that I'm the best candidate for this forum, African Forum of RD?
Mark, I'm with Da here. He confirms that we can hear you, we can hear Rosalia, but Côte d'Ivoire, the sound is not optimal. So it's not my connection. I'm with Da here. He confirms what Rosalia has said. We can hear you. We can hear Rosalia clear, loud and clear.
Okay, thanks.
And I
Jose,
can hear
you put,
Elizabeth loud and clear.
Togo. Put Togo. Spotlight Togo. Togo, can you speak?
Oui, bonjour. Nous sommes contents d'être avec vous ce matin pour faire ce test pré-session.
Togo is perfect.
It's good, but we don't have a candidate from Togo.
Yeah, no.
Je vous en prie, continuez, continuez.
Togo is fine.
OK. Donc, nous avons préparé pour vous un bon menu. En entrée, un steak. En sortie, un plat de résistance. Merci.
Merci beaucoup.
Le Togo, c'est parfait et il m'a donné faim en plus.
Elizabeth, you are that?
Sound is great.
Donc la salle est plus éclairée que chez
Merci beaucoup, Togo.
Okay.
Okay.
Your name is what rather John.
Tieno and Gator.
Germany.
Can you? Yeah, can you maybe reach your sound because there is too much echo and we are not hearing you properly. On peut pas t'entendre très bien. On pense qu'il y a trop beaucoup d'écho et le son quand ça arrive ici, c'est pas vraiment ça. Mais pour Togo, il n'y avait pas de problème. On attend Togo 5 sur 5. Mais Guinée et Côte d'Ivoire, c'est pas vraiment ça. Donc, on va répéter. Si vous avez fait les changements à Guinée, et si vous avez fait les changements, tu peux recommencer.
Oui, merci, merci.
Comme ça.
Le changement que j'ai fait, c'est de passer du microphone Logitech au microphone du laptop. Là, je parle à travers le microphone du laptop. Je ne sais pas si c'est stable. Et si ce n'est pas stable, je peux revenir sur le microphone du Logitech. Et aussi, on a aussi prévu de remplacer
OK. Merci, Tieno. Maintenant, c'est mieux. Elizabeth, did you hear Tieno well?
It's 3.5 sur 5. I'm with Da here. He agrees with me that it's not. We wish to have at least 4 over 5.
De mon côté, on entend beaucoup mieux. Pardon, Elisabeth.
C'est mieux. C'est mieux que tout à l'heure, mais c'est pas 5 sur 5. Le Togo, 5 sur 5. La Côte d'Ivoire, 4 sur 5. Et là, on est à 3,5, 4 sur 5. Mais c'est mieux que tout à l'heure. La Côte d'Ivoire, si je peux me permettre, vous êtes à contre-jour, j'ai l'impression. On voit une lumière derrière vous qui vous rend à contre-jour. Je ne sais pas, l'éclairage, peut-être si vous pouvez mettre un éclairage devant vous pour que on peut être à contre-jour.
Oui, c'est ça.
Pour la Côte d'Ivoire, ce que vous aviez dit?
Oui, je dis que vous nous apparaissez à contre-jour, c'est-à-dire que il y a une grande lumière derrière vous. Et ça fait comme si la personne qui est là, on ne la voit pas bien, on voit que la lumière qui ressort. Donc, si vous pouvez soit éclairer ou changer l'angle pour que le candidat soit éclairé et pas la lumière derrière fasse contre-jour.
On va changer de lumière. On va mettre quelque chose derrière aussi pour...
Dis-moi, Guinée, ils ne peuvent pas utiliser le même système que les autres et enlever le lecteur, je ne sais pas. Ils ne peuvent pas, hein, Marc? Je trouve que Guinée, il n'est pas aussi bien placé et positionné que Côte d'Ivoire, c'est la meilleure image. Ça veut dire qu'on n'a pas l'impression, on a l'impression qu'il est dans un studio. Ça veut dire que c'est la hauteur de sa caméra, tout est parfait. Or, en Guinée, la position n'est pas optimale pour le candidat, je trouve. Il ne regarde pas directement dans la caméra. Peut-être c'est ça aussi qui fait qu'il y a un doublon. Parce que le micro, le logiciel est meilleur.
Non,
C'est meilleur.
Meilleur?
non, les laptops étaient mieux. Les laptops.
Yeah.
So, Tieno, you will need to change your. Il faut changer votre position. Parce que vous êtes un peu incliné.
Exact.
Oui.
À désavantage du candidat. Et même Togo, je trouve qu'on voit trop la table. Il y a beaucoup de tables.
Mais Togo, ça va, il n'y aura pas de candidats.
Et il pourrait encore zoomer peut-être.
Togo is not going to.
Ah, ça c'est beaucoup mieux.
Oui, c'est bien, mais le problème, c'est que quand les candidats sera là, je ne sais pas, vous avez fait comment que ça reste comme ça. Est-ce que c'est les caméras qui ont bougé ou c'est les chaises?
Ah, non, tout à l'heure, c'est la caméra qui a bougé.
Ok, ok.
Le temps est aussi mieux que mieux, non?
On l'a mis sur un trépied, la caméra.
Ah,
ok, c'est bon.
Voilà.
Ah, donc, on reste avec Côte d'Ivoire. Mais Côte d'Ivoire, ils sont obligés de changer de position. Parce que the background is not good.
Yeah, that does.
They should just put either white background.
It's a window. It's a window.
Anyone is good.
Ngaita, est-ce que vous pouvez faire les backgrounds blancs contre le mur seulement, pas contre les vitres? Ils sont pas là. Hein?
That's the town hall.
Yeah, that's the town.
It's the town hall now.
Yeah.
I'm going to connect.
I didn't see you since. No. Hey, we can't say bonne année. It's called the prescription. Prescription.
Je disais pour Côte d'Ivoire, on cherche un background pour un peu diminuer le volume, la luminosité là.
Ah oui, c'est bon. Il faut chercher. Si vous avez un background blanc, c'est mieux.
Ah ok, on cherche quelque chose de bien là.
Je pense le départ.
Mais il fait plus frais. Sur 3 le matin. À peu près.
Je disais. Côte d'Ivoire, collègues de Côte d'Ivoire et Guinée, est-ce que vous avez aussi des bannières à placer derrière le candidat comme c'est visible actuellement au Togo?
Mais les bannières,
Regretter mon Brazzaville.
ne représentent pas l'OMS.
Ici, vraiment, il n'y a jamais de souci.
Peut-être les drapeaux de son pays.
Yeah.
Avec le clair.
Ou le...
Oui, on en a, on va placer ça et puis on va mettre ça, on va placer ça.
Mes collègues viennent de soulever que peut-être ce serait mieux d'avoir le drapeau de leur pays plutôt que la bannière de l'OMS. Que je vois chez Côte d'Ivoire. Je vois en Guinée, mais pas chez Côte d'Ivoire. Vous avez des petits drapeaux à placer ou un grand drapeau à mettre derrière?
Oui, on va placer ça.
Excellent. Excellent, merci.
Pour la Guinée, la qualité du son, est-ce que je peux remplacer
beaucoup mieux.
Oui, Guinée, la qualité des sons, c'est bon. Moi, je propose.
Il est devenu même le meilleur maintenant.
Ah, d'accord, super.
Super.
Et Côte d'Ivoire, est-ce qu'on peut faire un autre test pour le son?
Josué, active le micro de la Côte d'Ivoire.
On devrait se zoomer.
So we take it.
Yeah.
Because we want to know whether we are fair or not. It's important.
Yeah, it's important to know.
Maybe I'm stuck in Padani.
We're going to connect now here.
Eh?
Go back.
Oh, you want to hear the town hall from here?
Yeah.
Okay.
That's here.
Relax.
Okay. Côte d'Ivoire et Poissy. On va, parce qu'il y a des 10 town hall qui commencent maintenant. Donc, on va couper et après le town hall, on va continuer. C'est bon?
Merci, c'est bon parce qu'on nous avait déjà sollicité pour la salle. Merci beaucoup, Mike.
Ok, merci. Hein.
Ouais.
Voici, on va continuer après le temps de DJ.
D'accord.
Ok, Côte d'Ivoire, c'est la même chose.
Okay.
Thank you very much, colleagues. Colleagues online, we're going to take a break and resume after the DG Town Hall. Thank you very much.
Bye.
Oh, the town is full. We can't connect.
If someone is connecting, can you just use your computer?
Mark, can you sit away a little bit from Eniko? Let me just for now. Yeah, that's perfect. That's perfect.
Okay.
No, the chair.
No,
No, just the chair.
I think just move the chair. That's what she said.
No.
Perfect, just
The
a
chair.
bit.
No, because when the president is on,
Exactly.
then
It's
we
perfect.
should not
It's okay.
see the others, right?
No,
And
it
then
doesn't
I have
matter.
here.
No, it doesn't
Oh.
matter seeing the others, but I was just doing it in relation to the other one, the distance. No, that's perfect. Excellent. Excellent. Okay.
Good morning.
It's cut.
Huh?
The flag is out.
Yes. Okay. In reality, we have two of these backdrops, but the second one is still used by Ardi in his office. And so what the plan is that we put this one like this, okay? The other one beside, and in the middle we put the flag, okay? Somehow like this. Okay? Yeah. So we would have two backdrops, and in the middle where there's how you call it, the
flag, yeah.
Is a gap, we will put the flag. Okay.
Nice.
Would that be fine?
Flags.
We didn't hear you.
I said I wish we had two flags because I like the way the flag on that side. It would be nice if we had one on the other side, but you don't have two.
Okay.
From here, there will be another backdrop. So the flag will be in the middle.
Okay, that's fine.
All
That's
here
fine.
is another backdrop.
That's fine. Perfect.
Okay.
Okay. So this would be the angle when the president, I guess, starts, right? I just asked Cielo to bring already the nameplates, so he's bringing them. So this angle would be for the president when he's starting explaining the procedure and all this, right? And we have already the 4 balls here. Then we have also already prepared the little bag to draw the name of the candidates in which order they will come.
We have the balls.
Not yet.
Oh, activé Nicole.
I was yesterday in shops and we found something, but we look for even better if we can find. If not, we take what we have.
Anika, you have a picture of what you found?
I'll forward Nico.
Do you have a picture of the thing you found?
Yes, I sent it to Noemi. Are you with her in the same office?
No, wait.
No, just
I'm forwarding.
Okay. No, you don't need to forward. Okay. Okay. Because did you see the one you saw? Okay. No, that's not bad. Where was this in where was it? Acacia?
It was in Orca. It was in Orca.
In Orca. Okay.
Yeah, it was in Orca. So I mean, I found it not bad, but if we can find something a little bit bigger, slightly bigger, it would be probably nicer. But if not, this would do it.
Okay, and Eniko, don't forget we need to write the names big. Okay.
Exactly. That's why I thought if it could be bigger, then the names could be also bigger. That's why I thought. But yeah. To be honest, when I visualized the video, the streaming video, in reality, you could not read the names on the bows. So the bows were like big like this.
Okay.
And still you could not read it. So
yeah. Okay. No problem. So we just need to make sure we write and yeah, because we need the key thing is they need to be able to see that we're putting in that we put in the names in and that she's picking up names. Okay. That's fine. No problem.
Unless we take a paper and then we put the balls and then the names are on the side like this. We write the name.
Yes, that is also possible, yeah. What do you think, Pamela?
So we stick the paper and then each ball will be in front of the paper.
Is that an idea?
It's a good idea, but we'll also, yeah, we can do that. We can do that. Yeah.
Okay. We can then print out the names.
But we can also, but we also have to have the names on the board, but then they can be smaller. Perfect.
No, the name of the president will be here, okay? And then you will have a ball here and here and here and here. So the names would be under the ball, not in front of her.
I understand that. No, what I'm saying, Enrico, I clearly understand what Mark is proposing. I think it's a good idea. All I'm saying is that we should also have the names on the bowl. That's all.
Of course. Yeah.
So, I understand exactly. No, I think it's a very good idea. And then as we finish one candidate, we take the bowl out and take the name and then, or maybe still leave it even. Okay, good idea. Perfect.
Okay. Probably we can now zoom out, how it looks like when we zoom out to see everybody.
Zoom out?
Yeah.
When we start.
In the last time it was
because in the last time we would zoom out
just one or two times you zoomed out, yeah.
Like this is the zoom out. You see everyone.
Does it disturb the books in front there, or should we take them away?
Sorry?
The books there. Or should we leave it? I mean, the books. The books is not good because it's not the subjects are totally out of concept. I think it's not a good idea to have books there which have nothing to do with.
Are they WHO books?
No, not even.
No way. Then take them out.
Yeah, some gifts from the member states. I think like this is fine.
Nico, the horizontal line is not great. Is the camera not straight on the? Like you're a bit like this.
This?
No. You're tilted. It's as if you're.
Okay.
The horizontal line is not flat.
Yeah. No, what she means is look at the top of the.
Yeah.
You can see that this side is. Okay, let's see.
Yeah. Mm-hmm.
Change one I've done it increments.
Yeah, no, it's that side should be higher.
Yeah. Need to put a small thing in.
Josué, on peut aussi inverser l'écriture sur l'appareil.
You do it there, Zoom.
Ah ouais. J'ai oublié. Ouais. Ok. Allô? Que vous dites? Ah, d'accord, ok, merci.
How is it? How is it alignment now?
It's still not quite. It's still.
It's shifted to the other side.
Yeah. I think you need to make it higher, more volume, so that it's the more you push it like this, better it becomes.
Did you finish? Did you finish?
No, not yet. But which side is higher?
If you raise it on that side, make the volume even bigger. No, no, no. It goes even worse. You need to raise that, yeah. That's why I'm saying you need to make more volume, so it's not, yeah. You see? So probably we have to put more paper under it, or you have to, how you call it? And once more, yeah. Exact. Une suffit déjà. Donnez seulement le premier, le machin. Et puis, s'il vous plaît, vous pouvez, avant de faire autre chose, est-ce que vous pouvez aller imprimer le nom d'un des candidats et le plastifier?
Juste un nom.
Le nom un candidat. Comme ça, on voit à quoi ça ressemble. Et vous emmenez le scotch.
Still a bit.
Still, yeah, you need more paper, or to, how you call it, fold it even more. Noémie? Ah, ils ne sont plus connectés.
Yes. Yeah,
Ah,
I'm here.
Noémie. Wait, yes. What do you wish for plate?
Okay.
For the chairperson. Yeah,
I
it's
like
better.
the short one better because it's more readable. Pamela, are you seeing the nameplate?
Ah.
You're muted, Pamela, I think.
The one on the left, definitely. So it's to your right, but to our left. The short one, definitely. Yeah. Perfect. Yeah.
Nice. Yeah.
Bon. I sent the CLO to print.
Is it,
Can look at
Enrico?
Yes.
On the other side, what's on the other side?
What do you mean?
On the other side of that. Should we not have one in English on one side and French on one side, and we can rotate it halfway?
What would you rotate it, or?
We can swap halfway, or you think you just keep it as it
yeah.
is? No, it's okay. Leave it. It's fine. Chairperson, it's okay. Ça va. She's English speaking, so that's fine.
Yeah, because the session is here English. It will be on English channel.
Yeah, it's English. Yeah.
The
No
timer
problem.
thing, the timer page, it's in French. It's okay.
It's in French. Can I see it?
Can you put
Yeah.
the timer? Yeah.
And the session will end according to the candidates forum run-off show at 1:30 p.m. Is that correct?
No, we don't know. This is what we estimate. Okay?
Yeah, because on this page it's written 4:30 p.m.
That's okay. Doesn't matter because that's what we were proposing. If we finish earlier, that's fine.
Okay.
We don't want to say that we're going to finish at 1 and then we go run later. Let people be available.
Okay, yeah, okay.
If
I
we finish
understand
earlier,
the
then
point.
that's fine. Yeah. We had to say that, Eniko, we had to say that because remember we had 5 candidates before.
Ah, yeah, exact. Because I was wondering why would we put 3 hours more than expected?
No, we had 5 candidates
yeah,
and then 1 pulled out. Yeah. Is that the timer that you're showing?
I think he did not finish yet.
Okay. Who's working on that? Jose? Jose?
Jose, yes, Jose.
Okay. Is Mark there?
Yes, I'm there.
Mark, I tried to rename myself. It says change name tag and virtual background. I tried to rename myself and it's not accepting it.
You're supposed to be using your own link. There's going to be a link which is going to be shared.
I am using my own link.
Oh, what was the link which I sent you?
No, I came off. Did you notice I came off at one step? I realized that what Jean sent was an invitation and I accepted it. So I couldn't see into my email, but it was on my calendar for Wednesday. So I went there and I joined that. So I'm on as Drame. Even the link you sent me was my name.
Okay.
But I can't change the name.
Yeah. Oh, you can't change the name.
No. So I wonder if it's going to be the same for other people.
We
But
need
it's
to
okay.
cross-check.
Yeah, because when I say it does say change name and then I change it and then I say apply, but it doesn't apply.
We'll check in the meeting settings.
Yeah, okay, that's fine. Because I wanted to put WHO Afro in front.
Because where your timer is it's got blue on top, blue on the side. At least the blue on top should be trimmed off on top.
Naomi, try and change your name as well and see if it works.
I'm connected as co-host, so I might have a different experience.
Yeah. So the timer, this is what we are saying. It's in this language, French.
Should the page, this holding page, be in English?
And then we have the other timer, isn't the one with the 2?
Yes.
Okay.
Pamela, the page, what you can see right now, should it be in English? That's the question.
You can leave it in French. You can leave it in French. It's fine.
Okay, that's fine. So can you put the other timer, the one with the 2 times?
It's coming.
But that's...
Don't worry. First I will change the background.
Why? Okay, have the 2 timers ready, and then we need to practice the change. Because there's no way we are going to do this like this.
Mais vous m'excusez, si le chair est anglophone, ce n'est pas mieux de mettre en anglais temps restant pour interview, non?
C'est ça que j'ai pensé aussi.
Hein?
Pamela.
Yeah.
So the chair is the anglophone.
Yep.
So wouldn't it be better to have the timers in English?
The text.
The text, because, yeah, of course, yeah. The text. The timer is just yes, because it is to the benefit of the chair. The ones who are supposed to handle the meeting.
Okay. You can have it in. Why don't you do it? Okay, if we're going to do it in English and French, we need to put it in Portuguese too. So that's
English
fine.
and French should be too much text.
Yeah,
Exactly.
I think I would. I prefer it in
Okay,
English
you can leave
because
it. You can leave it in English. No problem.
Yeah, I
agree.
think so.
Yeah.
Yeah.
Exactly as Mark said, it's for the benefit of the chairperson. So if you read something in another language, you might get confused. I mean, it's not so confusing, but still.
Yeah.
So I just wanted to say that we have already prepared the little bag with the names of the 4 candidates that we will give to the chair when it's time to choose the order of candidates passing with the interview. So this is fine. Mr. Cielo is printing now out what we said with the names under the bowls, so you can have a look on the template. And then the last thing is the bowl, I think, which is remaining. Okay. Okay. Bon, c'était 100 virgule, mais on peut d'abord mettre... Non, non. Ok, d'accord. On peut juste mettre... Est-ce que vous voyez... Ah, est-ce que... ici? Oui, oui, bien sûr, bien sûr. C'est bon. Ah, mais vous n'avez pas l'argent. Je dois vous donner là. Ok, d'accord. Oui, on ne voit pas.
Roll them. You can start. Pamela, the timer.
Looks good. Looks good. Don't remember. There are going to be three times, but we don't need the 3 timers.
Which is the third timer?
They have 1 minute. Naomi, remind me, isn't there 1 minute for member states to ask a question?
Yes, it is true, but last time you did not count that. There was just 2 timers.
Okay, that's fine. Okay.
There was no timer
right.
for questions, assuming that people will not ask 3 hours questions.
Okay, that's fine. If that's what we did last time, that's fine.
Yeah.
Then. Okay.
Fix the blue on top of the timing.
So here we have printed, here we have printed the name first Guinea, yeah, proposed by Guinea, and then we have the ball here over it. Or we can also make it a little bit higher, like this.
The other blue is still appearing.
Well, we need to make it straight, and then put the ball here. Like this. Yeah? Would that make sense?
Yeah.
Does it?
You're muted. Pamela, we cannot hear you.
Yeah. But you should, by now you should learn to hear me even if I'm muted.
Okay.
You know, I can never get the hang of Zoom. I still, up to how many years, and I still forget to unmute. Sorry. You can't teach an old dog new tricks.
Would the timer be better? I think the timer is better in yellow. Eh?
Let me see. Let me unpin this. Because I
to
pinned
go
you
to
guys.
yellow? Okay. And then will it go to red?
Yes.
Okay. Okay, and then red.
Yes, exactly. Yes,
Okay.
yes.
Exactly.
Yes.
Ah, that's good.
Very good. Very good.
Yeah, that's good. That's very good.
Very good, guys. Eniko, you look so regal. And Mark, as usual, looks like a bodyguard.
I'm Eniko's bodyguard. Though she's not doing me very well these days.
Naomi, did you? Oh, you did. It worked. You changed your name. Okay, so only. So let me see. Okay. You have to make me co-host on that day, huh? You say.
Sorry?
Don't need to make me co-host today, but you have to make, because we may have to change like ministers. Did you put like honorable minister or whatever? Anyway, we can do that. All right.
Probably here.
Hey. What
Maybe we should put it whatever.
Are you doing the test with the two Côte d'Ivoire and Guinea? Are they connected?
Okay, Togo, are you connected? Can you say something? Your camera on?
Yes.
Yeah. Can you spotlight Togo as well?
Oui. Bonjour. Vous me recevez?
Oui, bonjour, monsieur le candidat.
Bonjour, Madame Pamela.
Ça va?
Oui, ça va bien.
Yeah.
So, Musa, why is the banner at the le banner, le drapeau qui est derrière là? C'est pas derrière toi, pourquoi c'est l'autre côté? C'est obligé d'être derrière. Comme nous ici, c'est derrière.
Ok, ok, donc ça doit être derrière, comme ça. Derrière
Oui, c'est...
Ok.
C'est ça.
So, Mark, is it only Togo on?
It's only Togo on.
Why?
Oh, that's the only banner that we have.
Why?
No, that doesn't look.
No, okay. Ah, okay, no, on comprend. Yeah, put it back where it was. Oui, c'est ça. On a bien compris pourquoi vous avez fait ça.
Mark,
No.
why are you not answering me?
Huh?
Where are the other countries?
The other countries?
Yes, Côte d'Ivoire and Guinea, because the candidates have expressed that they will go to those country offices.
We send them the messages to join the test today, but let me try to call them.
Because they are the ones, Togo I'm not worried about, because we've not received confirmation. It is Côte d'Ivoire and Guinea that we've received confirmation that they will go to the country office. So we need to test those countries. It's very important.
Okay.
For Tanzania, I'm around. You're right.
Huh? Jurel, can you put your camera?
All right. What about now?
Yes.
Durel perfect.
Yeah, I'm not so worried about Tanzania. I believe even Tanzania said he will take it. He does not need to go to the WHO office. So not worried about Tanzania.
All right. Okay.
So I don't expect him to come to you, but have a background ready in case he changes his mind at the last minute, okay?
Yes, we'll do that.
The two offices
I remember, Pamela, sorry. I remember that last time, the candidates had rather banners from their own countries. It was not WHO. It was not WHO banners. They brought. Probably you might remind candidates that they should take care about their own. Okay, yeah, okay. But the others brought their own backdrop, like Tanzania, government of Tanzania or Rwanda, whatever. I remember it was their own banners.
That's fine. Let them bring what they want, but they may also wish to have a WHO banner. That's fine. I agree with you. But I don't think we should write and ask them to bring it. Not at all. Yeah?
Fine.
I need to go on a call. I'll just be in the back.
No problem. C'est bon?
So what you suggest really when we have no, I'm telling you. Right. Yeah.
Noémie?
Oui, Nico.
Voilà. Oui, je voulais juste demander, vous avez envoyé le nom du leg chez nous? Vous nous avez partagé le nom. C'est qui le leg qui vient?
Excuse-moi, et Nico, répète.
Le leg, la
Oui.
personne de Genève qui vient. Est-ce que tu as partagé avec nous son nom pour sa plaque?
Je peux le mettre par écrit.
Ok.
C'est Joris.
Tu m'envoies ça comment?
Je t'envoie par email.
Ok,
Et
très
je le
bien.
mets en copie. Je le mets en copie, comme ça, si tu as des questions, tu les demandes.
Ok, il n'y a pas de souci.
C'est pour le nameplate?
Oui, oui, parce qu'on va mettre tout le monde. Mais ici, je pense qu'il faut ajouter honorable, Dr. Louis, comme elle est ministre. Merci, c'est bien reçu, hein? Noémie, Joris, c'est un monsieur. Joris, c'est un monsieur. D'accord.
Et Nico, je pense qu'on va devoir vous quitter dans 5-10 minutes si jamais il y a quoi que ce soit d'urgent à régler.
Oui, je pense que de votre côté, il n'y a pas de souci, hein. Je pense que vous avez eu une idée de quoi ça ressemble maintenant. Et puis, le reste, je pense que c'est plus technique.
Très bien.
OK. Donc, on vous tient au courant pour la vase. Et s'il y a quelque chose, on peut toujours t'appeler.
Oui, oui, absolument.
OK,
Tu
tout
sais
à
comment me
fait.
joindre.
OK, tout à fait. C'est bon, non?
Merci.
Oui, je pense que c'est bon, on a conclu, mais la prochaine, c'est le premier. Premier, on va faire le titre final avec tous les banners, tout ça sera là. Et on va essayer de faire une petite séance des interviews.
Très bien.
Marc.
Oui, chef de village.
Oui, le premier férié.
Premier férié chez vous?
Oui.
C'est le premier qui est mardi.
Ah non, 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 c'est bon, c'est bon. Non, c'est pas le,
Non,
c'est pas le premier.
31, non?
Ouais, c'est bon.
OK, c'est 31 de l'année.
Ok, c'est bon.
Ok. Merci.
Maintenant,
Bonne journée.
Merci.
Bonne
Bonne
journée.
journée.
Il faut nous confirmer l'heure.
Respect.
Respect.
10 heures.
10 heures. Heure de Brazzaville.
Heure de Brazzaville.
D'accord.
On va envoyer les messages en tout cas.
Ok, merci. Bonne journée.
Merci.
Bonne journée.
Ouais.
C'est.
C'est Moussa.
Okay. I think I set already a link for Monday, didn't I?
Oh, okay. I'll check.
I don't know, but we can add his name.
Yeah.
Kukutse. And who else? Kukutse and?
Gaita.
Oh, you will do it?
Yeah, I'll add them.
Okay.
I'll forward it.
OK. Donc, est-ce que je comprends bien que on va faire la séance? Ça veut dire que le setup maintenant c'est bon, mais on va simplement faire le vrai test avec les interprètes ou qui que ce soit qui est là mardi, c'est ça? OK, très bien.
Mardi, on a toute la journée pour essayer, réessayer.
OK, super.
Joseph.
C'est bon? Oui, c'est bon. Oui, c'est bon. Parfait. Tant mieux. Donc, bonne journée encore. Merci.